Hi, my name is Kathleen Busby. I practice at Busby Eye Care at 16409 Southpark Drive in Westfield. We're located right across the street from Oak Trace Elementary School. We're a primary care optometry practice. We prescribe eyeglasses and contact lenses, as well as treating and managing ocular disease. And we also treat children and adults. The American Optometric Association, which is our national association for optometrists, has found that it's best to have children's eyes checked between age 6 months and 1 year, again at 3 years, and then at 5 years, and then every year after that. A lot of parents don't realize that their children are having problems until they have a note sent home from school, and by then there may have been several things that the child has missed at school that no one has realized. So they have found it's better to be proactive better than reactive when it comes to your children's vision. And we do have an associate here at our office, Dr. Aaron Buck, who is part of a public service program called Infant C, and it provides no charge eye health evaluations for infants aged 6 months to 1 year, and anyone is welcome to call to schedule an appointment for that. Both Dr. Buck and I see children age 3 and over. There are different tools and pieces of equipment that we use for children who are not speaking or not verbal yet, and it's by having them look at different directions and having them focus and track objects. And there is a way we can tell if they have a prescription or not just by looking at a light reflex in their eye and determining what type of prescription they have from that. So there's a lot of things we can do for nonverbal children, and the tests actually work well for nonverbal adults as well. During a comprehensive eye examination, there are several things that we check for besides a person's prescription. The common things that people are aware of are things like glaucoma, which is an eye disease of too much pressure in the eye, or cataracts, which is an aging of the lens in the eye. But there are many other things we can detect as well. We can detect things like tumors with the peripheral vision test. We have ability to photograph the inside of the eye, which is one of the only ways you can see internal blood vessels in the body without having to be invasive. So by seeing those internal blood vessels, we can sometimes see changes from high blood pressure, cholesterol, diabetes. Several things can come up that a person wouldn't even realize. They're in for a routine exam, and we can maybe sometimes see swelling of the optic nerve due to increased cerebral spinal fluid, and we refer patients for that. So there's a lot of things we can detect that a lot of patients probably don't even realize during an eye examination that can help with their primary care doctor with diagnosing things and sending them to a specialist if needed. We also keep the photographs on file, so whenever a patient comes back for future checkups, we can use those to compare notes to make sure that nothing has changed and that everything looks healthy. We're also qualified to treat what people consider pink eye or red eyes, eye infections, and we've had several patients come in who've gotten a piece of metal or dirt in their eye from their job and occupation, and we're qualified to remove those pieces of metal or dirt and treat their eye until it's healed. So there are a lot of things optometrists can do that people may not realize. There's more to it than just prescribing glasses. Very important part is prescribing glasses, but there's a lot of other things we can do to help with the overall eye health, body health. As long as people are coming in for the regular checkups, we're able to catch it in time. When a patient comes in for a comprehensive eye examination, we take photographs of the back of their eye. We do a test called a visual field test, which checks peripheral vision. It can detect things like nerve damage or tumors. We also check the pressures in the eye, which is one of the tests for glaucoma. We have an automated instrument that can give us an estimation of a patient's prescription and the curvature of their eye if they're going to be wearing contact lenses. We check color vision. Some people are born with color vision problems. Some people can acquire color vision problems. There's other things going on, so we always check color vision. We also check depth perception, which is a test that checks how well your eyes work together to make sure that both eyes are in sync and that you're seeing what you need to. That's all done in the pre-testing area. When you come back into the exam room, we fine-tune the prescription that was determined in the other room to make sure that you're seeing as best you can. We take a look with a microscope to make sure that the front surface of the eye is healthy, that there's no signs of any cataracts. Then we also look inside the eye, like we talked about before, to make sure that there's no signs of any eye diseases, tumors, retinal detachments, or other health issues we might be concerned about. A lot of people don't realize the importance of sun protection for their eyes. It's just as important as sun protection for your skin. They say that the majority of your sun exposure is before age 18. So it's very important to recommend sunglasses for your children as well. And there's a lot of good lines of sunglasses available for children as well as adults. They have found that cataracts and macular degeneration both can be caused by sun exposure. So a lot of people who work outside are definitely more prone to this if they don't wear sunglasses. Very important when you purchase sunglasses to make sure that they say that they're at least UV 400, or that they have 100% UV protection. Just because a lens is tinted does not mean that it protects your eyes. So you want to make sure you're looking at the labels. We recommend, like I said, sunglasses for everyone, children and adults alike. And a polarized sun lens is the best sun lens available. Not only does it have the UV protection, it also has an anti-glare feature to help with driving down the road, reflection on car hoods, reflections off of snow. If you like to go out on the water during nice months, it helps cut the reflections off the water as well. So it's very important to make sure you wear sun protection all year long. Even on overcast days, there's still UV rays in the air, so you want to make sure you're protecting your eyes as best you can, and make sure you try to do it as often as you can.